Today I want to talk to you about how to do a head-to-toe assessment. So you're probably wondering what this is. To define it, a head-to-toe assessment is exactly what it sounds like. It's an assessment performed by a healthcare provider that starts at the head and moves all the way down to the feet, examining all the internal and external parts of the body, including holistic aspects such as mental, emotional, and social health. It can be performed by a nurse, a doctor, or mid-level providers such as nurse practitioners or physician assistants. You're probably wondering, why is this important? If you want to go into the healthcare field, it's obvious. You need to know how to perform an assessment the correct way in a systematic manner in order to correctly gather all possible information about your patients so that you can care for them and treat them. If you're not wanting to go into the healthcare field, it's probably a little more confusing. Why do you need to know this? It's common knowledge in the healthcare world that a provider can't help their patient if they don't help themselves. If a patient knows what a nurse or a doctor is looking for when they look, listen, and feel different parts of their body, they can start to understand how to take care of themselves at home and monitor themselves at home. If they can fine-tune their body, they can pick up on things and help us take care of them better. So to get started, I'm going to call in my so helpful assistant, my husband. Hi, Chase.
Hello, everybody.
And we're going to jump right in. So with a head-to-toe assessment, you're going to start exactly like it sounds, at the head and move down. So we'll start with the head and neck. You just want to turn towards me, please.
Yes, ma'am.
We're going to start by looking at his eyes and his pupils. Are they the right shape? Are they equal? Do they move correctly? Do they move in synchronization? Are there any problems or visual deficits? And then we're going to look at his neck and look at range of motion in pain or difficulty moving. So please look at my finger and follow it. Good. So his eyes moved synchronously any way I move my fingers without difficulty. Tell me when you can see my fingers by looking straight ahead.
Now.
Good?
Now.
Good. So his peripheral vision is fine. Please look to your right with your head and turn your head to your left. Now look up towards the sky and touch your chin to your chest. Any pain or difficulty moving? Good. So the significance of all these things is that it could signify neurological problems such as a stroke, an injury, a brain bleed, or even an infection, such as meningitis, which commonly can cause difficulty touching your chin to your chest. Moving down, we're going to start with the chest. This is the part where we engage our stethoscope. We'll listen to heart sounds from the healthcare side, such as, is it irregular or irregular? Are you experiencing any palpitations? We'll also listen to lung sounds for any abnormal breath sounds, such as wheezing, things that we like to call rhonchi, anything that could signify an obstruction or a narrowing of airways. We'll assess for shortness of breath, and when the proper equipment is available, we can check oxygen saturations at this point. Also to note, throughout your assessment, it is optimal to get a full set of vital signs, which includes a heart rate, a blood pressure, oxygen saturations, any pain levels, and a temperature. So we'll listen. Could you take a deep breath in and out, please? Again. Again. And again. Good, you can breathe normally. Now we'll listen to heart sounds. Are you experiencing any shortness of breath, difficulty breathing? Any heart palpitations
No, ma'am.
or any pain?
No, ma'am.
Good. At home, if you're not a healthcare professional, you can always assess your heartbeat by checking your pulse in your wrist or your carotid, or just feeling over your chest. And of course, if you're experiencing palpitations that are noticeable, you would want to contact your doctor immediately or call 911. The significance of all of these are it could signify a heart attack, a pulmonary embolism, which is a blood clot in the lungs, um, COPD or asthma, of airway diseases, infections such as pneumonia, and other problems that originate in the chest. Continuing, we'll next assess the abdomen and pelvis. We'll listen for things such as bowel sounds. We'll ask about the last bowel movement and if its consistency was normal. We'll ask about nausea, vomiting, diarrhea, tenderness or pain, if appetite's been normal. And when appropriate, we'll ask about bleeding, such as rectal or vaginal, and last menstrual periods. Are you having any abdominal pain?
No, ma'am.
Any appetite problems?
No.
Bowel movements normal?
Yes, ma'am.
And no problems with nausea or vomiting, right?
No.
Okay. So everything seems to be in working order. The significance of this could be anything from simple constipation to something as serious as a bowel obstruction, which can cause, if untreated, death of intestinal tissues or colon. It can also signify pancreatitis, appendicitis, both which could be life-threatening if not treated, or infections such as viruses, stomach bugs. It can signify ulcer in the stomach or intestines. Or in the case of a female with bleeding or pain, it could signify pelvic infections, things such as endometriosis, or even pregnancy. Next comes the legs and arms. Here we're going to look for range of motion, whether he has any problems moving, if there's swelling, if there's any known injuries, new or old, that could inhibit his abilities, and circulation for pulses. We would check in the feet and the arms. You can also check wrist, a brachial, and a popliteal, which is behind the knee. Typically, we check pedal in the feet and radials in the wrists. Can you move your arms up and down? Can you lift up your right leg and your left leg? Good. Any problems or pain?
No, ma'am.
Good. And your pulses appear equal. I don't see any swelling, and for demonstration purposes, we won't check his feet right now. The significance of this could be injuries, possible strokes if there was a one-sided weakness or disability. Heart failures or kidney failures could cause new onset swellings, or a blood clot, such as a deep venous thrombosis or a DVT. It could cause swelling in the leg or extremity, pain, heat, and difficulty with moving. Next, we're going to do an overall assessment for injuries or disabilities. You should note that this point of the assessment is continuously assessed as you move down from the head to the feet. You're looking for anything out of the normal that's old, new, and can't otherwise be explained. Things such as fractures, other known injuries, a limited range of motion, amputations, weakness, difficulty walking or performing their activities of daily living, such as getting dressed, moving about the house, doing dishes, getting themselves ready, brushing hair, brushing teeth. Significance of this could be new symptoms, neurological, musculoskeletal, or old. Do you have any disabilities or amputations? Lastly, this is the overall part of the assessment as well. The general appearance. Is their skin tone pink and warm? Are they cold? Are they yellow? Do they look well or do they look sick? Believe it or not, this is a point that doctors look at and nurses look at. Is their clothing neat and orderly versus rumpled? Are their eyes bright? Do they have dark circles? Do they look not rested? Are they um, unfocused? The significance of this could be a tolerance of illness, a possible indicator of the length of the illness, and just a general well-being. Kind of tying into that point is their mood and mental status. Are they cooperative? Do they smile when they talk? Are they avoiding eye contact? Are they pleasant or do they seem downtrodden? Do they offer information or are they withdrawn? Do they have a support system? This is an important question to verbally ask your patient. Do you have a support system at home? Do you have family or friends that you spend time with or talk to with your problems?
No.
You don't have any support system.
I have a support system. My beautiful wife.
The significance of this could be depression or anxiety or mental problems, or something as simple as a cultural difference. Many times, some cultures can be more stoic in their symptoms and hold things back. This should not be noted as a negative quality. It's just necessary to know in order to know how to treat your patient. Thank you, Mr. Deaver. So in conclusion, it's kind of obvious how a healthcare professional might need to know how to do a head-to-toe assessment. Not so obvious why someone else wouldn't. But as we discussed earlier, it's very important for someone to know how to systematically, in a tested and proven way, monitor their bodies at home so that they may care for their health and better help their doctors to care for them. Thanks for listening.